Good evening, everyone. I'm Dr. Ravi Patel, consultant nephrologist at Surgery Hospital, Shivamogga. Today, I'm going to speak about the impact of hypertension on kidney diseases, as well as the vice versa, and what are the precautions, like what are the preventive measures you should take. First of all, you should know about the prevalence of kidney disease. We all know that, based on the recent report, it is almost 229 million per 229 patients per million population, and almost if we consider the percentage of kidney diseases, it is almost 16.5% of the general population. It's a very huge burden to the society, that such a very high incidence of kidney disease, and its prevalence also keep on increasing every year by year. So first of all, like after this, like how blood pressure, like what is the blood pressure, you should know about, like how measured and all those things. So blood pressure, when the heart pumps the blood to the peripheral circulation, the blood vessels, it exerts some pressure on the blood vessel. This is called the blood pressure, and it usually measured by the sphygmomanometer, and also it can be like in office, it can be measured at the home by digital BP machines. So blood pressure usually normally by 120 by 80 millimeter of mercury. Usually when you call high blood pressure, it should be above 140 by 80, and three different readings, like at the different settings. Okay. And how does our kidney filters our blood? Like I will tell about briefly. Usually kidneys are two. They are situated either of our plants, and they're like our fist side. Kidneys are composed of millions of nephrons. These are called filtration units. This once the blood is flown through this filtration unit, all the toxins, all those things are like filtered in the urine. And apart from this filtration about toxins, kidney also does many important function: regulation of our blood pressure by secreting some hormones, as well as the synthesis of our hemoglobin by secreting the erythropoietin. Uh, and also it maintains acid balance and removes excess of salt and water. These are the very important functions of the kidney. And how does this blood pressure affect our kidney and vice versa? Usually when the blood pressure keeps on increasing, like after the one, in the beginning days nothing will happen. Like once you start like high blood pressure for a long time, it will decrease the sizes of the blood vessels. Once the decrease in the blood vessel sizes, it will decrease the blood flow to the kidney, the filtration units. Once the blood flow decreases, it will keep on like damaging the like damages, and keep this damage keep on progressively increasing. So this is the main, like how it damages the blood vessels. Okay. And and who are the patients who are more likely to have a blood pressure? Mainly, this depends on the present scenario, lifestyle. Like those are obese, not like not healthy lifestyle, like eating junk foods, all those things. And other anybody is having the history of family diseases, like family history of any hypertension or an underlying diabetic history, or any patients who are having kidney diseases. Also, they are known to have a high blood pressures. And this long-standing high blood pressure is a risk factor for kidney failure. What are the symptoms of blood pressure? Why you should know this? Like majority of the patients, they will not know that they have high blood pressure. So it is our after 40, 45 years, it is important that healthcare professionals regularly check the patient. Those, and the second thing, those are having risk factors, like as I told, family history of hypertension, obesity, or diabetes, or any existing kidney diseases. This should be screened and checked. So our like responsibility of the healthcare professional is to uh, identify this high blood pressure people at the very early age, and try to treat it and prevent the progression of the end organ damages. How this blood pressure is diagnosed by healthcare professionals? Usually, this majority of these patients will be silent visitors to the clinic or hospital. So these patients comes with, sometimes they may present as a giddiness, headache. Sometimes directly they present with the mild renal dysfunctions. Like any other, they'll come for any other health checkup. Like that time, it will be diagnosed. So how they will, like usually in the hospital or clinical settings, they will check by sphygmomanometer. The sphygmomanometer BP usually normally by 120 by 80. Usually, if the three readings are more than 140 by 85 or 90, and like we label it them as a high blood pressure. After labeling them as high blood pressure, you should find out any it has got target organ damage or any existing disease like sugar regarding control, or a urine albumin examination to know the kidney creatinine will be checked once you diagnose the hypertension. And this kidney disease, these kidney diseases also can cause hypertension. So it's mandatory that any patient who present with hypertension, especially young population, it is responsibility to check the kidney function. This is by measuring the GFR. Indirect measure is indirect measurement, and directly we measure creatinine using many formulas. We define the GFR, and other one is urine albumin excretion. If it is more than 30 milligram per gram creatinine ratio, we label it as involvement proteinuria. How to prevent this kidney diseases is mainly like one is prevention as well as treatment. Prevention is healthy lifestyle. Healthy lifestyle matters a lot, like the physical activity, doing yogas, and maintaining healthy weight, BMI, keeping BMI less than 24.9, and any risk factors are there like quitting smoking, reducing the stress, and other most important, as the age progresses, we should decrease the salt intake. These are the like important preventive measures. Apart from this, once you are already diagnosed with the hypertension, you have to regularly you should take medicines as well as the decrease or cut down your salt intake. How can high blood pressure kidney diseases are related? This is very important. This high blood pressure related to any cause will damage the kidney, and any kidney damage will cause the high blood pressure. These are the vice versa. So once you diagnose with the high blood pressure, you should always check the presence of kidney damage, and this usually affects the like it's a progressive damage. Because of high blood pressure, it increases the intraglomerular blood pressure. That in turn will cause the progressive kidney kidney units. This is nephron damage and progressive kidney damage, and is how it will damage. And what are the medications we use to treat this prevention of progression of the kidney disease and hypertension? Most importantly, this angiotensin convertase enzyme inhibitors or receptor blockers. These are all mainly like enalapril, ramipril, or losartan. These are the very important medications. Other important medications, especially in a diabetic population, is tight sugar control, as well as the use of newer molecules like SGLT inhibitors. Physical activity, like how much physical activity should be there, like at least 30 minutes per day, minimum 5 days in a week. This much is the physical activity to keep healthy lifestyle. Body weight, as I told, that keep the BMI between less than 24.9, and that will be the very important to maintain the stress. You should know, like once the diagnosis of hypertension is done, you should regularly do yoga or stress management. That will in turn decrease the sympathetic activity and decrease the blood pressure. Eating healthy food is very important. Like cut down junk foods, decrease the salty, like especially these fried foods, all those things. And you should eat the low fat or cholesterol food, and high sugar food should be avoided. And red meat, all those things should be avoided. Like avoided. And should any like important dietary prescription is required, you should consult the uh, dietitian for the proper diet advice. And last one, as I told, like adopting the this like preventive measures and treatment of this hypertension, it's very important that you can early diagnose and treat this hypertension as well as this hypertension related end organ damages. That is the most commonly kidney problems, and also we should know that these kidney diseases, early kidney diseases also will not be like diagnosed. They will not present with any symptoms or anything. So proper screening of these patients who are presenting with hypertension, primary care physicians, is very important in early diagnosis and prevent the progression of the kidney damages. This concludes my speech. Thank you, everyone, who business also, and who supported me in giving this talk. Thank you very much.